Brooks, a doctor at DHR Health, says he's seeing a slight uptick in cases of the COVID Delta variant. Our Channel 5's Judy Gonzalez joins us live from our McAllen Bureau. Judy, I know you've been tracking this over the last couple weeks. Is this a threat to the valley?
Good Wednesday morning, Rudy. Absolutely. Dr. Suhail Rao with DHR says that although he's seen, that number of COVID cases and deaths, they've fallen here in the RGV, that still means that there is a threat out there. There is a threat in the RGV, especially now with these new variants that we're seeing. This specific one, Delta variant. A new variant bringing concern to health experts.
So the Delta variant is actually the variation that came from India. It is in March of this year, it was actually 0% in our population in United States. Today, it's almost close to a quarter to a third of all the people who are being diagnosed with COVID-19 who actually are with the Delta variant. So it is rapidly spreading.
Dr. Suhail Rao, President and Chief Executive Officer for the DHR Institute and Research Development, working closely with the FDA and CDC and learning variant characteristics. But in comparison to other variants, Delta,
it's far more contagious than the British variant, the B1117. And it is also, if you're not vaccinated, it is also far more lethal in terms of casualty, in terms of creating hospitalization for the patients.
A strain of the original COVID-19 virus, but has it made its way to the valley?
Yes, we do. In fact, DHR, along with all the institutions here in the valley, are now engaged in a Department of Health and Human Services sponsored and funded project to actually look at all the variants that we potentially could see in the valley.
And that's because not all tests locally will determine or detect a variant. Many of them are sent off to labs in Austin or Houston to determine the exact strain through sequence analysis. Dr. Rao says the RGV needs a more robust mechanism for testing, and he's concerned that the virus will keep mutating.
So right now, our biggest concern is long-term effects of COVID.
For those who contracted the virus.
And they are looking at what the long-term effects of people who have been infected, not those who have been vaccinated, but who have been infected with COVID.
Dr. Rao adds one dose of the Pfizer or Moderna vaccine is not enough to protect you from the Delta variant. He says studies have shown you're taking a risk if you skip the second shot.
I beg you, I urge you, go get the vaccine.
Now, Rudy, during my interview and during my conversation with Dr. Rao, I did ask him if most cases with these variants he's seen, as he sees patients on a daily, are, people that are hospitalized. He says they are, and he says that most people that are hospitalized with a variant are people that have not been vaccinated. In McAllen, Judy Gonzalez, Channel 5 News this morning.